Here we go. Hi, everyone. We are here today with Pink Table Talk, here for our September edition. I'm Haley Brown. I'm the Director of Programs and Partnerships at Touch, the Black Breast Cancer Alliance. And I'm here with my mom today, my co-host, Dr. Candace, and our amazing partners at Know Your Lemons. But hey, Dr. Candace, why don't you go ahead and introduce yourself?
Sure. Hi, everyone. I'm Dr. Candace Thompson. I am a breast surgical oncologist at Stanford Healthcare. I practiced mostly in the East Bay, so Emeryville and Pleasanton, and I'm happy to be partnering with Touch for another episode of Pink Table Talk.
Mom, who are you?
I'm Ricky Fairley. I am your mother. I am the co-founder of Touch, the Black Breast Cancer Alliance, and I'm hanging out with you today for a little while, maybe not the whole time, but such an important conversation. And we love you guys. Know Your Lemons. You're so awesome to work with us. And, we're about to enter what we're calling Breast Cancer Action Month, not awareness. And so we are taking action. It actually, I think, kicked off for us emotionally a few weeks ago, right, you guys, in our ecosystem. But we really want to talk about in September and frankly, every month of the year, every day of the year, we think about this and we really question the screening that's available for Black women. And so the self-exam is so important. So let's talk about it.
Yeah, so tell us who you guys are at Know Your Lemons.
I'm Corinne. I'm the CEO and founder of Know Your Lemons. My background is I am a graphic designer, and I use my design skills to help educate about breast topics.
Yeah.
And I'm Irene. I'm the development director at Know Your Lemons. And I'm really excited to talk more about why self-exam is a tool that needs to be in every young woman's toolbox, but especially young Black women, and how our tool can help give you an easy reminder and take away any questions that you may have around self-exam.
Totally. And when we found each other, it was like match made in heaven, like all the alignment with Know Your Lemons between our campaign for Love of My Girls. And so before I even talk about For Love of My Girls, but my mom show a quick video that really sums it all up nicely, and also the beginning of my voiceover career. So get excited. But yeah, so we under Touch, we created For Love of My Girls to really hone in on the 18 to 35-year-old, that demographic, given that, breast cancer, if you're Black women under 35 get breast cancer at 2 times the rate, die at 3 times the rate, and then we're told to get mammograms at age 40. So really just wanted to bridge that gap with this campaign. So here's a quick video. Girl, for the love of my girls.
Black women under 35 get breast cancer at 2 times the rate of white women.
And die at 3 times the rate.
It's up to us to take care of our girls.
The only solution is conversation.
I choose Black breast health because protecting my girls means protecting all Black girls.
I unlock my her story by talking with my family about our shared health history to know my personal risk.
I get to know my girls as an act of self-care. Are you ready to get in touch with your girls? Visit
loveofmygirls.org to get in touch with your girls.
So much fun.
That video gets better and better every time I watch it.
It does.
So great.
It's so fun. It was really fun to make too. We involved our HBCU interns. I called them up and Ubered them to this recording studio, and it was really, really fun to make. And yeah, so Touch has been on the move. We have been at Congressional Black Caucus this week. We have been really all over the place. We've been in probably 3 different cities this weekend alone. And I'm really excited to now pause and figure out what October looks like and get that started into October Action Month. And I think that that's why we're here to talk about Self-Exam September. It's another very clear action step for young women to take. So would love to hear, how did you guys come up with Self-Exam September? Well, actually, for starters, how did you guys get into this work? What is your why behind your breast cancer journey?
My why is my family. I have 3 grandmothers who died from breast cancer, and a really close friend that I grew up with. As I was trying to understand what that meant for me in my family history, what her story was, I realized I didn't know that much about breast health. I didn't know what to do when it came to breast cancer for myself. My family was not having that conversation. I don't know if it was intentional or not, but it just wasn't something we were talking about. And so as I started looking at things, I realized, at that point, 2 of my grandmothers had died from breast cancer when I started working on designing this campaign. And I thought, it took 2 people to die before I learned about breast health. That's a really high bar. And so I decided design could make it more engaging and interesting. And I thought if there was a great way to design this information, then people would look at it and want to learn more, rather than kind of being given like the usual clinical messages, like when we go to the doctor's office, we have the choice between looking at like some health pamphlets or like a 2-year-old People magazine. And we still go for that like old People magazine where some celebrities are still together, right? we're like, oh wait, no, like they got divorced ages ago, but I'll read this because we'd rather read that because it's like colorful and engaging and lots of stories and stuff like that, right? And then there's like this like little brochure about like your body part and you, right? And we're just not picking that stuff up. So I thought design can make a difference here. And so I ended up moving to London to get my PhD in the topic after I finished my master's with the initial designing of it, and just learned a lot about how to communicate for a global audience and make sure it's a message that communicated to everyone equally.
Yeah, Know Your Lemons is one of the things I love about it is that it is universal. You can, look at all of the marketing, all of the information, and it's completely edible to like everyone everywhere, which I love. So, and
Well, explain that a little more, like why lemons, and can you show the lemons, like people that don't know who you are? Because the first time I saw like the egg crate, I was like, whoa, this is so cool.
Yeah, I can. If I can screen share, I can show the lemons.
Yeah, you should be able. Let me make sure you're. Oh, Mom, you could actually make that capability now.
All right.
Yeah, no, it was.
Yeah, it looks like
It's just so clear, and concise in a way that it's memorable as well,
Yeah. So here
How
are
cool is
lemons,
that? How cool is
right? Showing breasts. The reason why it's designed this way is because if we show actual breasts, then all of a sudden there's all these places you can't show it. And when you can't show it, you can't talk about it. So lemons are great because they look like breasts without being breasts. They've got nipples. They've even got skin pores, right? And something that's really interesting is that it can also explain this. And that's what a cancerous lump can usually feel like, which is often hard and immovable. Not 100% of the time. There's no such thing as 100% when it comes to bodies, right? Anything that seems different to you needs to be investigated by a doctor, but typically that's the characteristic of what a cancerous lump can feel like. So being able to communicate that in a way that doesn't require words means we can show this to everyone regardless of literacy or language, and we're communicating it in a cheerful way. I mean, lemons are cheerful and friendly, makes it really easy to engage with it. And then that leads on to this image. There we go. And that's breast cancer has more than just a lump to know about. And so being able to communicate it in this way, it's a little unusual to have lemons in an egg box. But the reason for that is we know that eggs come in a dozen. And when you see these lemons, automatically you go, oh, there's 12. And so being able to look at each of them side by side and compare them to each other just makes it really easy to see what you're looking at. This image is translated into 34 languages right now. And women, after seeing this image, have recognized, oh, I actually have something like that. I didn't realize it was something I needed to bring to the attention of my doctor. And so it helps them go in and talk to their doctor. In some parts of the world, our lemon campaign is green, because lemons are green in some countries. So we have a green campaign for our lemons and then a yellow campaign for our lemons. But, you know, it's hard not to be cheerful around lemons. So it takes this kind of fear out of the cancer conversation, takes some of the embarrassment or taboo out of the breast conversation. And it's just, well, just look at these lemons and let's talk about breast health together, which can make it really easy to do. So we always ask people, please share this image. We have it pinned on our Instagram thing at Know Your Lemons. Share it, because so many people have said, I was diagnosed because my friend shared this picture on social media and it stuck with me. And a couple of years later, I noticed something. We had one girl who was a young woman. She was with her boyfriend watching Netflix on the couch, and he was scrolling through Instagram, saw this image and just leaned over to her and said, hey, did you know this? And she's like, oh, I didn't know any of this. This is really interesting. And so she like started doing self-exam, and a week later noticed a lump in her armpit and went to the doctor. And at the age of 24, she was diagnosed with breast cancer at stage 1. And so that's really important, because if we look at the survival rates according to stage, right, being able to get diagnosed in those early stages really means everything. And self-exam is one of those ways of helping us know our bodies. And then if something changes, then we're empowered to do something about it because we notice it. If we're not doing self-exams, we don't know what's normal for us. And so if something changes, it'll be harder to spot that. So that's why we're doing self-exam September, is we're wanting people to really get to know their body and do self-exams. So I cannot talk and stop my screen share.
I love that graph, Corinne. That is so cool. And I bet you, so that data is from Australia. I bet you if we looked at that data for Black women, stage 4, stage 3 and 4 bars would be a lot bigger, right, Candace, don't you think?
Yeah, I was going to mention that. So here in the United States, I'd say for Black women, it's a little higher than that still overall for most women, and even for Black women for stage 4. It's definitely higher than 30%, but it is still low. It's below 50, around 50 or lower, but it's not that.
Oh, yeah. And then I bet you if you broke it down for young women, it would be probably even worse, right? For young Black women, I'm going to tell you, we should try to look for that data and see if we can find it, because I think this could be a really compelling chart for us to show people how important early detection is. You know, that, I mean, good news is that the stage 1 and 2 numbers are so high. You know what I mean? I think that's, but I think we just have so many young women who are finding it later and getting dismissed by their doctor. So being able to see these visual images is so great, because you can say, hey, doc, wait a minute, you know, look at this. This is what look at what this is supposed to look like, and help people identify, you know, how they could stand up for themselves. So
absolutely. And that's the main story that we hear from people, is that they learned about the symptoms with us, and then they were able to go into their doctor and advocate for themselves. And that made all the difference, because the doctor would say, I don't think there's anything here.
Yeah.
They know, actually, I'm pretty sure there is something here. And what we say is trust your instincts. We have a tendency to know when something doesn't seem right. And the only evidence that you need to justify getting something tested is you being concerned and noticing a change. So, you know, if your doctor says, I don't see anything here, that's okay, because the test is what can help give us answers. And so it's okay to advocate for testing and say, you know, well, what can we do to be sure? I would really like to understand that. So
yeah, I really enjoy too because it is true that young Black women are getting like way too many de novo cases right now, diagnoses at that. It's just ridiculous. And so I love, the piece about the lemons being approachable to a younger audience because they are lemons, and that it makes it more, a little less taboo to be talking about boobs, especially if you want to be in schools and spaces like that. And so this is such a clear way to give that same information, share that same information and make it approachable. So that's like another reason why I love the Know Your Lemons, everything. But Irene, so why did you get into this work? How did you find your space, your life in lemons?
My lemon life.
Yeah.
Like probably everybody else on this video, I haven't been unaffected by breast cancer. I actually lost my aunt when I was 15, and honestly, I don't even feel right calling her an aunt. She was definitely more like a second mom to me. She was diagnosed at 29 and 42 when she died. The reasons were a little bit different. It had to do with some laws that have since been changed for reconstruction after a mastectomy. But regardless, I don't think women should be dying at 42 for any reason, especially breast cancer. And, for me, I was 36 and breastfeeding twins and had mastitis and realized I didn't actually know anything about my breasts, like at all. I knew a little bit about lactation, but that's pretty much the only thing that men think they're sexy, and that doesn't really do a whole lot for me. And so, when I found Know Your Lemons, to me, education's always been the great equalizer. But, we're able to educate everyone. We're able to touch everyone with the tools and resources we have. And right now, the best tool and resource that women can have is knowing, under 40 especially, is knowing how to self-exam, knowing what to look for, and really just about knowing your normal. And so we come in and we give this really clear language in a really easy to use format from our mobile app. You can watch a video, know how to self-exam, have all your questions answered right away.
Love that. Love that. So thank you guys for being here and sharing this information. It's going to be great. And Dr. Candace, I feel like I don't always remember your why and how you truly got into this work.
I actually don't have a personal story per se. I think I've known people younger, and not a family story, I guess I can say, but I have had friends and even a classmate who had breast cancer early in life, like in early 20s, one of which actually passed away. She was actually in her early 30s while I was in medical school. And she had breast cancer and died from it. Both were African-American. And just going through training and everything, I just really gravitated towards all of the research that's going on and all of the work that still needs to be done, especially what you all are doing with Know Your Lemons and educating people. I feel like that is a vital component because as Corinne said, whenever you show a breast, it's something that you can't show in a lot of places because it's shunned and you can't even talk about it. So I love that you're doing this Know Your Lemons. And I really like that pictogram that you used where it shows like the lemon with the nipple ducts and then the ducts branching out into the lobules and then showing. I think that's great because people don't even, whenever I talk to patients about like just different areas of anatomy of the breast, I'm like, this is the areola, this is the nipple. They don't even know what parts of their breast are called sometimes, which is astounding to me. So I think it's really important just to educate and get this out into the community and into the schools in order to talk about the breast so that people know what's going on.
No, that's so important. It's incredibly important. And those visuals are like super clear and make it approachable. So again, I obviously got into this work mostly because of my mother here, who's with us for a little bit longer, I think. But what?
Yeah, bye.
Bye. Love you.
Take over the host. I'll do it.
It'll keep recording it, or it'll keep, okay, cool. So, but yeah, and so I kind of think when my mom got diagnosed, I was 19. And so it was a lot around, well, now that I know so much, a lot of this campaign has stemmed from what are the things I wish I knew about my mother when she was sick, or like how to support her, how to have been a better person on her care support team, because, and how to then, make sure that I'm taking the right precautionary steps that I should be taking as a young Black woman who has a grandmother, a great aunt, grandmother, and mother who have survived breast cancer, which is so nice to say that was, I think we also had a great aunt, but that was obviously a long time before me. But yeah, and so this campaign, LMG, Know Your Lemons, this work that we're doing is really here to educate young Black women to make sure they have the tools that they need. So Corinne, actually, when we were on The Doctor Is In, you went over how to do a self-exam for real. And I feel like we should do that now again, but especially the part of, I'm now going to make a funny body motion, but when you do the hangover one, because that was a body position that I don't think I had ever thought about doing a breast exam in, honestly. And so please tell us how to
we'll do a mini class here. So we call this breast school. So everyone's coming to breast school. So the first thing to know when it comes to self-exam is what's inside your breast. Because if you don't have an understanding of what breast anatomy is, you're just kind of feeling blind. And that can be a really confusing experience. And that's why a lot of women say they don't really keep up on it, because it's a little confusing, right? Because breasts are lumpy. And so, understanding what different things can feel like is really important. So lymph nodes can feel like soft cooked beans. They're easy to move around. Dr. Candace, jump in at any point here, because I realize that like you're the expert. And then we have things that are like lobules that are here inside, and that's what produces milk. And then if you notice something that doesn't feel like these other two things, then that's something to get a sense for what happened. So everyone's landscape is different, and that's the purpose of a self-exam, is to know what your breast landscape is. So like for me, I noticed that I have like this like kind of lumpy area on the right side of my breast. It's been checked out multiple times. Everything's fine. That's just my normal. And so every month when I do my self-exam, I know like the landscape and what's normal for me. Something else that can be useful too when you're doing a self-exam is if you notice something on one side, check the other side in the same spot. And that can help you understand, oh, that's just normal for me. So that's something to look at. So number one, understand that there are going to be lumps that you're going to feel, and know what those lumps are. And then if you look at like a breast, this is a kind of rough way of explaining it, but there's lobes in the breast, and inside the lobes are these lobules. And so you're divided into sections. Sometimes when you're doing a self-exam, you can actually kind of feel these sections a little bit, especially if it's toward the end of your menstrual cycle.
Wait, guys, I have this idea right now.
Yeah.
I think that, I don't know if you've ever played around with this, but is there room to bring in like a breast density piece here, given like how much pulp you have, like, there's like an extra pulp moment here for your
Is it with bits or without bits?
You know what I mean? I feel like these visuals can add, we can go there,
Yeah, definitely. I love that. I love that.
With or without pulp.
I think, yeah, like, you get your orange juice. Sometimes I can do,
It makes sense.
Yeah, it does.
Lemonade,
It really does.
lemonade.
Why not?
Lemonade with or without the pulp.
Exactly.
It's either more clear or less clear. Yeah. So I think that a lot of people don't know about self-exam too, is the area in which you should be feeling for a self-exam. So a lot of people think that breasts are just the part that goes inside the cups of a bra, but that's not true. Actually, there are lymph nodes that are connected. There's breast tissue that extends up into your armpits. And so you should be feeling, from your collarbone into your armpits and to the bottom of your rib cage. This whole yellow area is the place that you should be filling in. And then you can see these little pink dots here are representing lymph nodes. So it's good to understand that. Dr. Candace, do you want to talk about why lymph nodes are useful?
Sure, yeah, I can talk about that. And I just wanted to make a few points. So for the lumps, you're feeling for something hard. Most of the time when it's early breast cancer, it's still mobile, so it can still move around, but it's something that's hard. Whenever it's immobile or you can't really move it, that's when it's more fixed, and typically it's more advanced at that point. So a lot of times, even if you feel something hard, if it's mobile, that's still concerning, and you should talk to a doctor about that. And then as far as the area below your breast, you don't want to go all the way to the bottom of your ribs, because that's sort of near your spleen, but you want to go to basically where the fold is, where your breast goes into where the ribs are. And then for the lymph nodes, what's really important is all over your body, lymph nodes are there in order to drain fluid throughout your body. So it's the same for the breast. There are lymph nodes that go along the breast and go all the way into the armpit, and the armpit is sort of where most of them congregate. And whenever there is cancer, the first place that it would travel would be to one of those lymph nodes that's right underneath the arm. So that's why it's important to feel underneath there, because if cancer has spread there, then those lymph nodes can feel enlarged. And that's also a point when you should talk to your doctor about that.
I feel like every time I'm on here, I learn so much more, which is so great about this show, because like even in the breast cancer space, you forget to keep yourself abreast of like knowledge all the time. You know what I mean? Like you have to like stay up with like what's going on. So Dr. Candace is always here to give us.
And then one other thing for the lymph nodes, the other lymph nodes that drain the breast that we don't talk about commonly are called subclavicular, basically below your collarbone, and also supraclavicular, so above your collarbone. If you feel a lump there, then or if you have cancer and then there are lumps there, a lot of times that means it's more progressed cancer. So the first place you would probably feel it, if you feel it anywhere else besides the breast, would be underneath the arm, but there are other lymph nodes that it can go to as well.
Yeah.
Like cancer has a fairly predictable way of spreading most of the time, and like lymph nodes act as those bodyguards to be like, you're not leaving here. And so as they kind of get attacked, those are kind of the first lines of defense. So if you notice something there, you notice that it's trying to leave the breast. All right, so here are 3 positions to use for a self-exam. So as you're watching, do this along with us. You're going to be able to learn this a lot better than just listening to us talk about it. But the first thing is put your arm behind your head like this. And what you're going to notice is that it's going to pull this muscle right here, and it's going to feel more flat. So that's the position that most of us have heard of for self-exam, is to lay on our back and then put our hand behind our head. And that's using gravity and our arm to stretch things to give us a flatter landscape. And with that, you would fill, into your armpits and around the breast and collarbone. And that's going to help you understand what your breast feels like when everything's pulled flat, and, being able to push against things to see if there is that hard lump there. And then another position that can be useful, and I'll stand up here, is to stand up like this, and then you just lean forward, kind of like a candy cane, and just really relax your arms. What you're doing is you're creating the opposite landscape. So instead of using gravity and your arm to like flatten that side, now what you're doing is you're using gravity for the opposite thing. And that can bring everything to the front. It can be a little bit easier to fill in toward against your rib cage because of that, because you're pulling all the tissue in front. Some people say that they were able to fill their lump when they bent forward, but not necessarily so much when they were leaning back, and then vice versa. Some people say I could only fill it when it was flattened, but I couldn't fill it when I was leaning forward. But those are just 2 landscapes to know, just using gravity in different ways, relaxing your muscles or tightening them. Can be really useful.
I'll hop in and say, my breasts are very different after breastfeeding 3 kids. And so when I was learning how to self-exam, I had always learned just this the standard first position, lay down. I had heard look in the mirror, but really it was just about laying down. And again, gravity does amazing things to the body. So for me, I have a lot bigger breasts than I used to. And a lot of it is just skin now, right? Because they used to be full of milk and now they're not. So when I lean forward, I am able to like actually feel what's going on in there instead of everything just being like flat and kind of like over to the side. It's a lot easier for me to be able to feel when, you know, my breasts are forward.
And that's true. So like knowing both landscapes really kind of gives you a sense of things. Just kind of understanding it from two different angles can be really useful. And then the last one is to look at your breast in front of a mirror. And so I'm going to have Bryony explain it in a little bit. We've got a video with Bryony of how she discovered a symptom of breast cancer by doing an exam like this. But what you're looking for is asymmetry. If one breast suddenly is a lot lower or bigger or has changed shape or something like that than it used to be. And then you're also looking for something called a dimple. So we showed you those 12 signs to look for. Those are the things you should be looking for in the mirror. And then we have Bryony that gives an example of what it's like to see a dimple. So I just want to make sure I'm.
And asymmetry is pretty normal. Again, like this is all about knowing what your normal is. And so, you know, if you normally have one breast that's bigger than the other, that's pretty normal for most women. But if you have a new change that you haven't noticed before, or your nipple is changing shape or color, any of those things, those are all cause to go to your doctor.
Yeah. And again, like a self-exam is not a hunt for cancer. It's a way of knowing what's normal for you. So every month you shouldn't be on a hunt for cancer. You should be making sure that everything's normal. Like that's the goal. All right. So here's Bryony. Right? Is that how it works when we're doing something? Okay, let me just pull it up on YouTube.
All good. Yeah, no, I think, yeah, Dr. Candace, while she's pulling this up, like, what are your thoughts on those three positions? Because I feel like it's not something that I feel like is always shared in the Black community.
Yeah, I think that the hunched over position is also a good position. Typically, as physicians, we routinely tell patients like upright and laying down. Upright also just allows gravity to take its course, and then laying down and then making sure whenever you're checking underneath your arm, trying to make sure that it's more of in a relaxed position, because if you're pulling too much, sometimes it's difficult to feel the lymph nodes. That'll sort of move the tissue up. But with the hunched over position, sort of like you showed, or just your arm down when you're standing up or upright, then you can feel the lymph nodes a little bit better when your arm is relaxed.
Like doing it in the shower is really easy too. Having a little bit of soap sometimes can just make it really easy and smooth to kind of go over everything. Just know it's going to feel a lot different if you've got a little like lubricant on your hand, right, when you're in the shower versus when you're just feeling like yourself laying down, and understanding that the normal feels different in those two ways is just more education and understanding that. All right, I've got the video now.
Let's hear it.
On the 2nd of November, I was diagnosed with stage 2 breast cancer. I had a 2.7 centimetre lesion in my right breast. I was at the doctor's surgery for a completely unrelated issue when I was getting ready to pay, and sitting on the counter next to the receptionist was the Know Your Lemons poster, because in Australia it was Breast Cancer Awareness Month. And I saw the poster and looked at one of the symptoms, which happened to be the dimple in the lemon, and went, that actually looks like my breast. I have a dimple in my breast. And I had put it down to age and having dimples and dents in other parts of my body, and not being aware at all that a dimple is one of the signs of breast cancer. It's not something I had ever heard of It's always been about checking the lumps and checking for changes in the nipple and hot spots and those kinds of things, but had never heard of the dimple. And from there, from my going to the doctors, from my diagnosis, and I've had my first chemo treatment 20 days after that. And it's all due to having that poster there. What I want to be able to do is show you what the dimple looks like in real life compared to seeing it on the lemon, which was the absolute prompt for me getting it further investigated. And I think actually seeing it in real life allows people to go, actually mine might look a little bit similar to that. So I'm very fortunate in the location of it is quite high on my chest, meaning you can see it. So here is the dimple. And one of the other signs associated with the dimple is that when you move your arm in directions, the dimple doesn't move, it doesn't change because the tumour's pulling down on the ligament or the muscle to create the dimple. It is soft to touch, there are no lumps around it, and it doesn't hurt. So I had none of the other normal signs and symptoms associated with breast cancer, and we have absolutely no history of breast cancer or any of the other associated cancers. So it really is being aware of that Know Your Lemons poster, the 12 signs that are associated with breast cancer, sharing it widely with your networks and allowing for the education to happen that breast cancer is more than lumps and more than the marketing that sits around that.
So like, it's really neat to be able to see, someone actually show you what that dimple looks like, and thinking about, at what point is it best to have this education? Because we know women will get diagnosed with breast cancer. And do you want to know about that dimple before the dimple shows up? Or do you want to find out about that dimple after it's shown up? Like that dimple is a sign of breast cancer or any of the 12 signs. So being able to have that information and know it when you're young is really important. Being able to share that and have an easy way to share it with people is important too. Because again, it was just that image of the 12 lemons in the egg carton, and within 30 seconds she went, hold on, because she knew her normal.
That's exactly what I was gonna say. It's so crazy to me, and I apologize right now because it is very much a football Sunday in my house right now. So like, if you hear screaming, that is I could, even if I asked for another circumstance, it would not happen. But no, that video is so crazy to me too, because it was like she did know her normal. She was able to just then see the image and identify something that she already understood or has noticed, and so it's just crazy that's the case. And I think it's so cool that she knew her normal already. So like, just taking that image to get her there that's all she needed. But it's interesting to know that there are steps even within knowing you're like doing knowing to do a self-exam, doing a self-exam, having the tool then to let you know what to find or look for,
Right. I completely agree. I think this really shows that also that it's important to do a self-exam each month, because a lot of times by the time there is a dimple, it is a mass that you can palpate. So she said that hers was 2.7 centimeters, which is an inch. And normally you can palpate masses that are around a centimeter or greater. So I think this also points to doing self-exams so that you know your baseline and you know what to look for before you see any dimpling.
Yeah.
There's been kind of a change of conversation, right, around self-exam. So I know I was never taught to self-exam. And, they really haven't been teaching self-exam for the last 20 plus years. I remember seeing the shower cards and, in my mom's shower, and nobody ever gave me a shower card. And Corinne actually just sat on the World Health Organization's Global Breast Cancer Initiative and was really kind of instrumental in bringing this topic, like, why aren't we talking about self-exam? Why aren't we teaching self-exam? Why are we talking about breast awareness? Yes, I'm aware I have breasts. What does that mean? What action does that give me? Corinne, maybe you can just talk a little bit about why the word self-exam is such a dirty word now.
Yeah. So health recommendations are based on evidence, and evidence comes from well-designed studies. There aren't a lot of studies that have been done long-term on the impacts of self-exam. There was one study that was done in China, very well-designed study. And what they found was that teaching someone self-exam or not teaching someone self-exam didn't make a difference overall in the number of women who died from breast cancer. So the medical community took that to mean that self-exam is not useful. What the study actually found was that these women were pretty good at finding tumors that were 2 centimeters in size or smaller. It's likely because these women were in China that there were smaller breasts in this population that would make it easier to find a lump that was 2 centimeters. There's also some cultural aspects around if someone from the government asks you to do something and they ask you if you've done it, you're going to say, absolutely, I've been doing my self-exam every month, right? But there's a lot of kind of things and around that. So because of that, and the study used the phrase self-exam, the medical community started recommending against self-exam, but that it was important for women to know they're normal through practicing breast awareness. And you practice breast awareness by doing a self-exam. So it's kind of like, we can't use the words, so we're gonna say something ambiguous that no one can interpret in a way that's very clear. So as Know Your Lemons, we've said self-exam from the start, because that's what patients understand. They know what self-exam means. Self-exam means looking and touching your breasts. Breast awareness is like a really abstract term.
What is it? Yeah.
There's nothing concrete about it. And so all this effort's been put into like, well, let's explain breast awareness in a way where we don't say self-exam. And so the WHO in their breast cancer initiative report, they say self-exam. They say self-exam is important. Self-exam should be practiced. They point out the Chinese study. It was done by University of Washington in Seattle, but they're pointing out the study that was done in China was not designed to determine if self-exam was effective or not. It was about teaching self-exam. And we actually don't know how they taught self-exam in the study. That's not something that's included in the documentation for this. So worldwide, 90% of women find their own breast cancer. We know that if women are practicing self-exam, they have a much greater chance of finding it at an earlier stage. If they're educated, they know the symptoms. If they understand breast anatomy. And then the last thing would be understanding what we call breast cycles. So I'm going to share my screen with that to point out this last piece to know when it comes to self-exam.
I'd like to say something really quickly about the self-exams, though. I think there has been a lot of talk within a lot of organizations now talking about bringing back breast self-exams. I always promote breast self-exams for my patients. I know other surgeons who definitely do as breast surgical oncologists. And then also it's really important because 40% of breast cancers are found by palpation, either by the doctor or by the patient. So it's something that I think we definitely need to advocate for and teach.
Yeah, absolutely. Right. Like, so a doctor will see the doctor once a year, and we might be seeing a doctor who doesn't perform a lot of breast exams. And so they're not going to be as well practiced or versed in that. Also, when we fill our breast, we fill through 2 directions. We can fill our hand that's touching things, but we also can fill from inside our breast, right? And we're going to be able to fill kind of both directions. So that's an advantage as well to no one's going to be able to fill your breast as well as you because of that, because it's your breast. So having that understanding, and it's great to see that the medical community is starting to come around. We know when it comes to policies that's a slow moving thing, but individually people are starting to say, you know what, maybe it's okay to say self-exam, because what by telling women not to self-exam, that implicit message was you don't need to know your body.
Right.
And just wait till you're old enough to get a mammogram because breast cancer is not going to happen to you before then. Like those types of things, which are not true. And so it's good to have that message of do self-exams because it's good for you to know your own body. It's good for you to take charge of your own health, and women should know their bodies. There's no one else who should know your body better than you.
Yeah, and there's also, I mean, if you're under 40, you know, for young women and young Black women in particular, there isn't really any other tool that you have. You're not, you know, of age to get a mammogram, though we believe, you know, personalized screening should be a thing in the US, and, you know, everywhere. But yeah, in particular, if you haven't reached the age of 40 and you don't have a history of breast cancer in your family, then you're not going to get screened. So you have to screen yourself through self-exams and know what your normal is and know your own body, and then know how to advocate for yourself should you need to have a symptom investigated.
Yeah, just to add a couple pieces about screening too. Been working with this company called Bexa. Yesterday, we screened, I think, over 25 women in the DC area at this event, and it was really, really great. And still great to even have the conversation with people just around what your screening regimen should be, right? And like know her story for that reason, understand your family risk for that reason, make sure that you are like, for example, my sister, you know, given our family history, she's in the process now of figuring out what next steps she wants to take. Looking into a prophylactic mastectomy, looking into it at least, you know, because I think she's a 34% chance of getting breast cancer at this point. She's had her 3 babies, you know, and like doing well. So like, why not look into this? But even just going to start that process and look into it, she's now on the track of doing the like MRI every 6 months, or like getting screened every 6 months. So doing an annual MRI, annual 3D mammography, and just getting that 6-month regimen, right? Because it's like, that's the level of screening she should be having, regardless of, just given our family history. And so as soon as you start that process, you then know what you need to do for screening wise. So I think it's super important to get in the habit of, and then, yeah, like even with your mammography regimen, you still want to do your exams every month, right? It's like these things don't preclude you from doing all the other things. But yeah, no, Corinne's in the show. Yeah, like super handy dandy and like making it really accessible to do that, to do your checking your.
So I'm not able to screen share on the app, but I just want to tell you about a couple things that are really useful in the app when it comes to understanding screening. So we have a risk assessment on the app, and usually how a risk assessment is done, it's with your physician, and the end of the assessment will have a number. So there will be a score, and based on that score, the physician will make decisions with you about what screening plan you should be on, such as what tool you should be using and how often. The way our risk assessment works is to help you understand if your average risk for breast cancer, possibly increased or increased risk for breast cancer. And we use the guidelines from the American Cancer Society about what the screening should be for people with different risk factors. So it doesn't spit out a number, it spits out bullet points of risk factors that you should talk to your doctor about to make sure you're on the right screening plan. So if you have no risk factors for breast cancer that would determine that you would need an enhanced screening plan, then we say, here is the standard recommending screening plan for you. But then if you have some things that pop up, then we say, okay, you have a conversation with your doctor, and you can put into the app, oh, I should be doing a mammogram starting at age 35 because of my family history, or whatever that conversation is with your physician. But it's just a way of being able to put together some bullet points that you can have this conversation with your doctor, have a starting point to say, hey, it says I'm increased risk, so should I be doing mammograms more, or should I be adding MRI to my screening plan? Those types of things are really useful. And that's not a conversation we always get the chance to have with our doctors, depending on who our doctors are. So it's a useful tool. And then it will send you a reminder every month to do a self-exam. And it times it according to your menstrual cycle. So I'm going to share my screen really quick with that. So we call this a breast cycle, but it just follows your menstrual cycle. And so here in this pink is the days that you would be bleeding. And then a couple days after is what we call the ideal window to be doing a self-exam. This is because estrogen and progesterone are much lower in your body. And what happens is towards the last half of your cycle, you have these hormones that are cycling through your body, right? Because it's trying to prepare for a possible pregnancy and those sorts of things. And so what happens to the breasts is they can become more swollen, they can become more tender, they can become more lumpy, and then those lumps go away as the new cycle starts. And so sometimes what happens is this last half of our menstrual cycle, we start to notice that things feel tender, and we start to notice just some like tender lumps and things like that weren't there the week before. And that is sometimes when we end up doing our self-exam, because we're like, oh, our breasts are really talkative. They're saying a lot to us right now. But if you understand what a breast cycle is, and you understand, oh, actually, this is normal. Like this is something that breasts do. And in a week, this is going to settle down and it's going to be different. And then if in a week or two, this doesn't settle down, it's not different, then you go, like this is something that's not normal for me. So not only is doing a self-exam important to know your normals, also good to know like what your breast cycle is like. And
I love that too. I remember Dr. Mo loving you saying talkative in such a fun way. It's like, yeah, and it's no different from knowing your personality at different times of the month and knowing, like it really is, you know what I mean? Like knowing you're normal in so many different ways, adding breast to like the things that we practice knowing ourselves about, like why would you know? And this reminds me so much too, and thinking of another point of collaboration for the Touch for Love of My Girls, Know Your Lemons moment. But like, I think a part of your risk exam, and I took it forever ago, so now I don't even remember, but wouldn't it be cool? I'm going to share my screen too really quickly, actually. I think it'd be interesting to like this is our Her Story worksheet. You can find it on our website, loveofmygirls.org, and you go down here to our Unlock Your Her Story piece, but like adding the pieces that relate to the Black woman into the Know Your Risk, like high blood pressure, hypertension, those risk factors that might be present in the Black woman, to like, because like it's essentially the same. We're trying to like say like, hey, this is your risk, and give you then the tools to say take to your doctor, because these are just tools that help you be a part of the conversation. But it'd be cool to align all these things, because like I'm learning so much recently about prostate and breast cancer and that relation in Black families. And so just like having that, and I love our worksheet too, because it asks the age at which the people were diagnosed. I think that's become noticeably more important, especially as I dig into information about women and pregnancy and breast cancer. I'm hearing crazy things about that. But Dr. Candace, I feel like you had some thoughts too, and then we're gonna the hour went by really quickly. We can close out after some
Yeah,
thoughts.
I just had a few thoughts. So for the risk assessment, I love that Know Your Lemons, the app, like has an assessment tool for everyone to use. And I just want to emphasize that the NCCN recommends getting a risk assessment starting at age 25 for women. So I see high risk patients as well as patients with cancer. And I go over those risks with the patients as far as like if they're at elevated risk and what to do if that's the situation. So I strongly recommend knowing your risk and asking your doctor for a risk assessment if you haven't done so, if you're 25 or older.
Absolutely. And the app is free. We don't collect any health information. Everything stays on your phone. So it's a very private app. It's also available in English, French, Spanish, and German. If you speak any of those languages. Mona Lisa is a self-exam coach. She's been doing self-exams for 500 years, and she's very good. And she will help you understand what each part of the breast feels like. We've had people that have said, when I did the self-exam with Mona Lisa, I found a lump I'd never noticed before, and they were able to get it checked out by their doctor. And some people had it checked out and it was fine. Some people had it checked out and it turned out to be cancer. And they were so glad that they were able to find it earlier instead of waiting for it to progress and become really obvious. So, you know, it's all about being empowered, being educated, and choosing to know things in advance in case this happens, rather than being passive and just waiting for life to happen to you and then having to react to all of it. And, you know, being able to educate in a way that's easy to talk to our families about, knowing our family history, that sort of thing. And even if we don't have a family history, you know, most people diagnosed with breast cancer have no one in their family that's had it. There's not like a magic shield that forms around you because no one in your family's had breast cancer yet. It just means no one in your family's had breast cancer yet. At some point, someone in your family is going to have breast cancer. So it's important to advocate for yourself and really prioritize your breast health. And it can just be as easy as feeling yourself once a month and then crossing it off your list. You can actually report that you've done a self-exam on the app and you get like a little reward. That's fun. So we recommend it. Just helps you keep on track. If you set a goal, it's good to have a tool to help you keep that goal.
Totally. But yeah, if there's like one thing you want the young Black woman to take away from this piece today, what would it be? And I think mine is around, since I'm wearing my South by Southwest t-shirt, I met this lady there who was her job was a futurist. And I was like, this can't be a real job, you know, like this, but it was such a cool concept because it was just the thought of like, everyone is in control of the future based on the actions they take right now. And it just makes me think about telling young Black women, telling myself, reminding myself and my peers to turn our awareness into action. Self-exams are a clear way to do that. And again, you can link to on the Love of My Girls website, you can go down to like the roadmap at the bottom, find out where you are in your self-exam journey, and it'll take you to YSC's Tick Check that has a great self-exam. And then it'll take you, if you're like, I need to build this into my routine, it takes you to the Know Your Lemons app. And so you can like start to build these things into your routine in a meaningful way. So those are my last thoughts. Be a futurist.
I would say that breasts are amazing, and there's still a lot that we're learning about breasts. There's so little we know about breasts. You know, we talk about cancer a lot, but like there's, you know, breastfeeding and all kinds of things. It's just, you know, take some time to really love and appreciate your body. You know, love your girls by knowing your lemons. And the more that we know our bodies, the better off we are.
And find a self-exam buddy. Text your best friend once a month when you do your self-exam. Send them 2 lemons. Say, do you love your girls this month? Do whatever you can to help empower the women around you and yourself. And when you hold each other accountable, it just makes it so much easier.
Yep.
Totally.
And I already said mine about the risk assessment, but I guess also just make sure that you try to stay as educated as you can about your breasts and about your body so that you can be proactive about what's going on, and really know what's going on with everything. So, yeah.
Well, thank you guys so much. Love of My Girls is going to be in Oakland this week. So like look out for all the things that we are doing. It's Breast Cancer Action Month, so we are all on the move. So make sure to keep up with all of our social media at Know Your Lemons, Love of My Girls, Touch BBCA, so we can keep in touch with all the, like, literally we're going to be everywhere. So come find us somewhere and learn more about your Black breast health and knowing your lemons and staying in touch with your girls. So thank you guys. Thank you, BlackDoctor.org as well. And we'll see you next month.
Bye. Thank you, everyone.